Mental health patients must now pay for services. This is because the government has not yet released funds to the Mental Health Authority. Early this month, the authority was forced to introduce a cash and carry system at the 3 psychiatric hospitals or stop admissions due to lack of funds. On the floor of Parliament on Tuesday, the Minority Leader Haruna Iddrisu called for an increase in funding for mental health care in Ghana.
The Mental Health Authority has called for the passage of the legislative instrument, LI, to end the reliance on government for funding. The LI includes the establishment of the Mental Health Fund to help run the various mental health facilities in the country. As at last month, the government had not released money for the Mental Health Authority. For this and other challenges, the authority had no alternative than to stop admissions or resort to cash and carry. The authority says the lack of political will to have this LI passed is affecting mental health care in the country. On the floor of Parliament, both sides spoke against taking mental health issues in the country for granted, since it can affect anyone at any time.
We want to believe that the Minister for Health will activate and operationalize this particular act in order to give meaning to it. I agree with my colleague that we should bring back mental health care to national development agenda. We should have a rethink of what we consider as persons with disability. We should include persons with mental health disabilities, and then how to group them together in furthering our national development agenda.
The Minority Leader Haruna Iddrisu says the country needs to take a national decision to resource the Ministry of Health and the Mental Health Authority, because even in terms of training, there are still gaps.
We need to take a decision on it nationally and to resource the Ministry of Health, the Mental Health Department. Even in terms of training, there is still inadequacies managing them. Mr. Speaker, maybe in your directive, our Committee on Health may want to visit and see the state.
Other speakers asked for part of the MP's Common Fund to be used to educate and support mental health at the community level. The Mental Health Authority and its partners continue to advocate for the country's lawmakers to pass the LI to establish the Mental Health Fund to be fed through the Mental Health Levy. Thus, they propose can be part of an existing levy or capitation like the NHIA, VAT or Road Fund. Until the LI is passed, the authority will continue to depend on the government for funding, and the psychiatric hospitals will always be cash-strapped and unable to function effectively.